Hi, Dr. Alina Kolchitsky, Boutique Bodyworks. Today we're going to go over TMJ exercises to help with jaw pain. So the TMJ, or the temporomandibular joint, is where the lower jaw connects to the base of your skull. It's just right here in front of your ear. Okay, so sometimes this joint can become aggravated, irritated, and painful. And there's many reasons why that can happen, and arthritis is one, which often is wear and tear or overuse over time. Teeth grinding is a big one, and so prolonged tension or stress over time in the muscles around controlling the TMJ, and that can cause inflammation. So sometimes a night guard is necessary to help correct the problem and reduce the tension and strain. That's something you can talk to with your dentist specifically, or your doctor, but really a dentist will probably have to diagnose and fit you with a mouth guard. But mouth guards can be expensive, not always covered. There are over-the-counter options where you can make your own mold from the kit they provided, or there are things like plackers, which are just an upper kind of plastic plate, if you will, that has a little shelf that you kind of clips around the back, not clips, but places around the back of your upper jaw. So it's not like an upper and lower mouth guard, it's just upper to create or place something soft between your teeth surfaces so that at nighttime you're not grinding. They're disposable, you only wear them for 3 days and then throw them out. So that's a temporary fix if you're wanting to hesitate or need to wait on doing a dental guard or can't get in right away. So those are some options to help immediately, but there's certain do's and don'ts. So do not chew gum. Chewing gum over time can cause TMJ. It can reinforce imbalance in how we use our jaw muscles. Just like anywhere in our body, we aren't even. Sometimes we use or dominate one side over another. And so with the TMJ and time, chewing can lead to the problem. So by chewing too often, too long, you're increasing tension in that area. You're maybe reinforcing imbalanced biomechanics or body mechanics, and that can cause or irritate the problem. So no chewing gum. Also wearing a night guard, but deep breathing, relaxing. When you're resting, try to keep your teeth separate. So don't clench your teeth at rest when you're doing things as well. But think about keeping the tongue on the upper palate towards the front of your teeth, just behind your upper teeth. By keeping your tongue up there, it immediately makes the jaw relax and releases the tension in the TMJ muscles. So those are some do's, placing the tongue on the tip of the top of your palate behind your teeth. Also, you can do some gentle massage. You can use warm or moist heat. You can use cold ice massage with ice cube, just 10 minutes at a time. Do place something between you and the ice so that you don't freeze your tissue. Same with heat. Have a washcloth or something between you and the hot pack so that you don't burn your tissue. So those are some options to help with pain. You can use ibuprofen over the counter, short term, not long term, so that you don't, have other issues related to prolonged ibuprofen use. And again, you can talk to your doctor or your dentist to help figure out what is causing the problem. But tension, prolonged tension over time and overuse and arthritis as a result can lead to that. Of course, there can be trauma from a fall, a car accident, some kind of blow to the jaw to one side or what have you can cause also trauma to the TMJ joint. So just very quickly, this is from Oxford University. And basically, you can see kind of a picture of the TMJ joint. So here's where the jaw meets the base of the skull, and then we blow up this to this bigger square here to see how there is this fossa or cavity, meaning space, and this disc that slides in and out or in between these surfaces when you open and close your jaw. So that disc can get punctured or irritated or worn as well with TMJ. So I just wanted to point that out. Now, I like the Oxford program because it's just one exercise only to reduce the strain and pain and trauma to the jaw. So what you want to do is make sure you do this twice a day for 2 minutes to 5 minutes. And in the beginning, do it in front of a mirror so that you can see that you're opening your jaw and mouth evenly. So what do I mean by that? Well, if you put a pen in front of your mouth vertically, when you open, both sides should open evenly and close evenly at the same time. Okay, so do it in front of the mirror for the first few times to make sure that you're doing that right, or in front of your phone. Do it with the video so that you can see if it's opening evenly between sides as you open and close your mouth. So it's just one exercise only. You're going to repeat this exercise for 2 to 5 minutes twice a day, once in the morning, once in the evening. Best time is when you first wake up and then when you go to bed. Do make sure that when you do it that you're sitting up. So do not do this laying down. You need to be sitting up with good posture. And that's the other thing for do's. Do have good posture. Don't or avoid bad posture, because bad posture can put strain on the neck muscles and thereby affect your TMJ, creating tension there. So keeping that chin alignment of, ear over shoulder, over hip, over knee, over ankle can help to prevent tension and strain on the muscles that affect the TMJ joint. Okay, so what is the exercise? Let's go over this first, and then we're literally going to do it for 2 minutes. So first step is placing your tongue on the top of your mouth, so on the upper palate, at the front, so just behind your teeth. Like that. So you're just placing your tongue here, then you're going to glide your tongue to the back of your palate. So obviously you're not going to be able to see this, but I'm going from my tongue being at the front, gliding towards the back of my mouth, just along the roof of my mouth. So front roof of your mouth to the back roof of your mouth, and you're going to keep it there. Now that you keep your tongue there in the center, at the back, then you're going to slowly open your mouth while trying to keep your tongue touching until you can't keep it touching anymore. So you're opening, opening, opening to that very last moment that you can't maintain contact with your tip of your tongue on the back of your roof of the mouth. When you get to that point, hold it there. You're going to hold it for 5 seconds, and then you'll relax, and then you'll repeat it. So 2 to 5 minutes, just this one simple movement in this sequence. Okay, you ready? So I'm going to give you some visual cues. So we're going to do it, I'm going to point this way to show that I'm placing my tongue on the front roof of my mouth. And then I'm going to point this way to show that I'm going to the back of the roof of my mouth. And then I'm going to go down to show that I'm opening my mouth. And then I'm going to go like this to show that I'm relaxing the jaw. Okay, so it's going front, back, down, and relax. Okay, here we go. 2 minutes. Okay, in the beginning, notice that I didn't hold it for 5 seconds. That was my mistake. So I corrected it as I realized it. And so they were longer holds further into the 2 minutes. Remember that, hold it when that jaw's open. Once you get to that ultimate open place where you can't quite maintain contact of the tongue at the back of the roof of your mouth, hold it for 5 seconds. Okay, hope that helps. It's just one exercise only. Isn't that great? There's a lot of information out there on the internet where they're going to make you do all kinds of resisted in different places and then manual stretches. Why not just try one thing only, do it well, do it for a week. If your symptoms don't improve, go back to your doctor or your dentist. And again, if anything ever should feel sharp pain or increase your inflammation or ever have redness, heat, swelling, and so on, those can be signs of infection. Make sure that you talk to your doctor immediately to get yourself assessed. Okay, hope that helps. That's TMJ, just one exercise only, twice a day for a week. After that, as you can. And then remember your mouth guard if possible, and remember to relax. Deep breathing exercises, relaxing, maintaining good posture, that when you aren't speaking or chewing, to try to have your tongue just behind the roof of your mouth so that your jaw can relax. Okay, that's all for today. Thank you.